So, Dr. Dean Axelrod, thank you very much for joining us here for the Happy Smart City podcast. And as you had requested, I will make this distinction, Doctor of Law, especially considering the topic here today. But also, please do allow me to make a very explicit remark here. Thank you very much for your efforts during the COVID-19 pandemic. Many families benefiting from your efforts. A lot of people have lost loved ones, families left in destitute condition. People's finances are in shambles. And it's people like you who are holding, society together. Very difficult job, but you're giving it your everything. So thank you.
Well, thank you, Tiaho. It's for that acknowledgement. It has really been a privilege for Direct Relief and for myself personally to be able to be a part of a response that in whatever way we can to try to have an impact. And this has been a devastating situation globally, as well as here at home. I don't think there's anybody who, anywhere, who hasn't been touched by just the devastating nature of this disease and the pandemic, COVID-19. And it's been a very humbling and privileged experience to be able to be a part of that response. So thank you.
Yes. So our first question for you is, what is your current occupation?
Well, I am Associate Director for Partnerships and Philanthropy at Direct Relief. Direct Relief is a privately funded nonprofit humanitarian medical assistance organization created in 1948 in the aftermath of World War II. And now, 73 years later, we have an operation that provides humanitarian medical assistance at no charge to people in all 50 US states and the territories of the United States, as well as about 100 countries every year. If listeners would like to learn more, www.directrelief.org has probably more than you want to learn about Direct Relief's history, what we do, who we work with, where we work, and why.
Lovely. Now, how does your role contribute to the economies of cities?
Well, I guess we need to look at what drives the economy of a city. And I think the basic answer to that question is people. And when the people who live and work in a city have access to high quality healthcare, urban economies run well and more equitably. So the idea of Direct Relief basically is pretty simple. People find themselves in need of things they cannot afford on a chronic basis if they are deeply trapped in poverty, or in emergencies when many people find themselves in crisis. And we have built an accredited medical distribution center. It was the first and only one in the United States when it was created, run by a nonprofit, that allowed us to provide prescription medicines and vaccines at no charge anywhere in the United States, in addition to the 100 or so countries that we serve every year. And the idea was that we should bring to bear for humanitarian purposes all the tools and technology that clearly have been so forceful in business and industry. We run an SAP backbone. We have to track everything just as if it were a commercial sale, despite the fact that it's being provided for free. That's a heavy regulatory hurdle that's associated with prescription drugs, obviously. And although we do it for free and for humanitarian purposes, it's essential to do it as well as it's done commercially. So we're committed to trying to fill those chronic gaps that exist as best we can by mobilizing private resources and putting them to work for the public benefit in as efficient a way as we possibly can. And so the scale of this has become quite large. Direct Relief is now the largest channel of humanitarian medications in the world. And with respect to COVID, it's been a privilege, as I said, for us to be able to step up and help community health centers that serve people in the United States and around the world who really don't have other options except going to an emergency room if they're in an urban environment, if they're able to access an emergency room hospital facility. So all of this is interconnected with the economies of cities and commercial markets. In addition to the direct impact of mobilizing medicine and medical equipment, grant funding, data to under-resourced communities within cities, you see microeconomies developing out of the work of these community health facilities. Often they're rural and hard to access, and the people who live there are struggling under the best of circumstances to drive and develop their own economies and contribute to the broader economy. So neighborhoods where community health workers are providing care for people who don't have other access to healthcare, backstopping hospitals and emergency rooms so they aren't overburdened by patients who have otherwise manageable conditions, but which can become life-threatening if untreated, it gives them a shot at breaking out of the cycle of poverty or recovering after a natural disaster or other crisis. And so where direct relief grant funding, for example, supports construction and maintenance of healthcare facilities, installation of modern infrastructure, think, for example, of direct relief's installation of solar power and refrigeration in Puerto Rico after Hurricane Maria, bringing cold chain to other parts of the world to grow the capacity of facilities to provide COVID vaccine and other vaccines, cancer medications, insulin. All of this directly supports a part of the healthcare economy of cities that markets aren't working in or aren't able to support because there's no profit for them. And governments either aren't able or willing to fill all of that need. What we often see is that what drives the commercial side of an economy is measured by metrics that don't apply to large segments of the population. And so by direct relief's ability to come in and fill those gaps, we're able to stimulate parts of an economy that would otherwise languish. I think we can see this even in greater depth in places both in the United States, but we often think of this in parts of the world that are severely under-resourced, where healthcare enables children, particularly girls, to go to school, women to participate in the economy and support their communities and their families when they're not prevented from that because of their own illness, having to care for a child, having to care for an elderly parent. And I think you can take this even further, where you see innovation hubs, government funding and programs, corporate projects in urban environments where there is a strong profit motive, all of which requires a healthy workforce and a consumer base, where one of the things that we've seen during the COVID-19 pandemic is that people that we consider essential parts of the workforce to drive these economies are extremely vulnerable and often don't have access to healthcare resources that are able to keep them healthy and working. And we've seen the potentially catastrophic impact of a workforce that doesn't have access to healthcare as we go digital in so many areas of life, including medicine, and with public health dependent on digital access. Large populations, large portions of urban populations are more and more left out. So supporting primary care and specialty care where there might not be access otherwise is critical. These are all important economic drivers in cities. And I think a smart city, getting back to the theme of this podcast, happy smart cities, a smart city is not going to be able to deliver on its promise if a large portion of its population is sick, doesn't have access to healthcare, if large segments of the population are left out because of the digital divide. And that's not going to be a very happy, successful, smart city. And the smart technology that cities are looking to adopt won't solve these problems on their own. It might help if it's done in a thoughtful way that brings in stakeholders who otherwise aren't necessarily part of the mainstream economy yet. So direct relief's work, both directly and indirectly, has a very powerful impact on the economies of cities.
You took my word there. I was just about to say so powerful. So I will agree with you 100% there. Very, very important work. And in case people aren't aware, in 2019, the US spending on healthcare was about 4.6% of the budget, and it was around 3.8 trillion.
Hmm,
So
yeah,
that just gives the perspective of how big the demand is for your services. And truth of the matter is, the government is still very much under capacity, and
yeah,
you're again very, very much needed helping hand there. I will also agree and just highlight, from my end as well, that human beings, of course, the citizens are the driving force of cities.
yeah,
And if you don't have a good healthcare program and, services that do reach the people, then you're in trouble because your bottom up organic economic development will suffer. So again, I mean, you said that healthcare provides, an opportunity for girls to go to school, and I can definitely agree with that. I can also sort of just end off in my end to say that with a healthy workforce starting
yeah,
from childhood, you reduce your government costs if you can get it right early. Because if kids don't get the right vitamins and the nutrition they need at a very young age, then their immune systems are going to take a beating. And over time, these people will require more healthcare services, and even fall into much more dangerous and lethal and even expensive spectrum of diseases like cancer, which is, some of the non-communicable diseases you mentioned. So our next question for you is, could you share a brief history of giving in healthcare and an outline of the modern frontier?
sure. I'd be happy to. But I just have to comment briefly on something you said a moment ago, which is the value of those early interventions of a wellness approach, keeping people healthy rather than focusing only on treating disease. Really is critical. And I think whether it's public health officials in government or private organizations doing public service work like direct relief, and the philanthropists who have supported healthcare for such a long time, it's taking that short-term and long-term approach. It's working on keeping people healthy while also treating illness and disease. Philanthropists in the United States have been involved in public health programs in the US and around the world since the turn of the 20th century, but I think you can go back even further in history outside of the US um, and domestically to find origins of hospitals and kind of the roots of modern healthcare as charitable institutions that were supported by religious groups and wealthy philanthropists. So this history of giving in healthcare, begins by establishing what have become modern hospitals. And then what we saw was philanthropy starting to turn its focus to, rather than simply housing people who are ill, to focusing on specific diseases through medical research and funding that research and funding disease prevention programs through educational outreach. And from there, you see an evolution of philanthropic support enabling um, new treatments, vaccines, new ways of preventing disease. We see then a partnership with government transitioning the role of hospitals and healthcare in a society, and taking a new view of the government's role in creating access to healthcare. You see partnerships, philanthropic partnerships with government. You see universities and private companies coming together to work on solving some of these healthcare problems. But one of the things that you didn't see was fully being able to solve the problem of equitable access, creating amazing new medicines and treatment methodologies and approaches to healthcare and wellness, but that weren't accessible universally. You saw institutionalized healthcare philanthropy now establishing itself, and even in the support of nonprofit hospitals. And with all of this, still not doing enough to close the gaps in equitable access to high quality healthcare. So, to fill those gaps, you saw organically created neighborhood or community facilities. And this is where direct relief, from its founding, targeted assistance, looking for those community-based health facilities that have evolved everywhere there are people in need in the history of the world. I think I'll put myself out on a limb to suggest that throughout human history, where there has been need, you have seen people with a stake in the community and the skills to provide care coming together to provide access. And the challenge then becomes the resources that they need, the medicines and medical equipment, and in some cases, the need for facilities um, to be able to reach people who otherwise wouldn't have that access. It makes me think of the arc of this kind of giving and philanthropy and healthcare reminds me of the old story about you give someone a fish and they eat for a day. But if you teach them to fish, they eat for a lifetime, which I think clearly, if you step back and think about it, is a great image, but it doesn't really hold up. Um, there are um, communities everywhere where you find uh, well-skilled fishermen who go hungry, who are poor because they're not employed, because they don't have access to fishing equipment and access to healthy fisheries. A lot of poor, hungry fishermen in the world. And I think that analogy is easily carried over into the area of healthcare, where there are trained doctors and nurses and community health workers, whether we're talking about um, parts of urban America, rural America, rural communities around the world, um, and and we are even seeing the vulnerabilities in urban developed areas around the world. And even in Europe, we saw during the pandemic huge challenges in creating equitable access, even where there are healthcare systems that are designed for pretty universal reach. So private and public financial support for charitable healthcare, community and neighborhood health facilities that evolve, free and charitable clinics. The modern state of giving in healthcare looks like very community localized focus, with rural outreach and a variety of safety net healthcare services and facilities that are offered without regard to politics, religion, or ability to pay, um, which then leads to the next step, which is, so we've equipped the fishermen, um, and now we need to make sure that uh, people who need the fish have access to that catch. So accessing a doctor, getting a diagnosis doesn't guarantee access to medicine to treat an illness or a chronic condition, or in a condition like cancer that may require a more sophisticated and ongoing treatment regimen over time, making sure that there's ongoing access. Challenges of poverty and transportation and other social vulnerability factors make it difficult to receive ongoing care for chronic conditions. And so private giving, we see in the United States, pharmaceutical companies participating in the federal 340B drug pricing program that's designed to help safety net clinics provide access to medicine for patients who meet certain access poverty guidelines. In-kind giving, all of this is designed to help, in conjunction with private financial support to organizations like Direct Relief, making sure that that next stage of access to healthcare, that level of giving brings the circle to fruition. So I think that's kind of a snapshot of where we were and where we are. I think the modern frontier of giving in healthcare is really focused on equity. It's that access, not just to a facility, not just to a doctor, and now not just to medicine, but to digital resources. So we saw again the digital divide during the pandemic became very clear, and the implications, whether you're talking about a patient's access to digital resources or you're talking about a health facility's access to digital resources, that made the difference in a lot of communities between folks having to go without care and those who were able to get the care they needed, whether it was something as simple as smartphone access to have a consultation with your doctor. The next step up, adding a video feed to that. Next step up might be a more sophisticated telemedicine system, which gives access to medical specialists who otherwise weren't available. And these things that became apparent and put under a magnifying glass during the pandemic, these are challenges. These have always been challenges. These are challenges 365 days a year, and were challenges before the pandemic for many people, many healthcare facilities in the US and around the world. Like in any natural disaster that direct relief responds to, what we've seen is that what they need in an emergency is what they needed before the emergency. They just needed a lot more of it, much greater scale, and they needed it faster. And they're going to need it again once the emergency is past, once this pandemic is behind us. You're going to see that there will continue to be a divide, there will continue to be gaps in where there's access. So direct relief, for example, is looking at the future, at that frontier, by focusing financial resources on equity, looking to experts in the field, in community health, giving those stakeholders that typically don't have a voice in the mainstream system, making sure that they have a voice in finding solutions to closing those gaps and bridging those divides. So we're looking at how to address the social determinants of health, the toxic stress, poverty, access to healthy food, decent schools, jobs, transportation, safe, affordable housing, family demographics, household demographics, all of these things that are not of choice to the people who are affected by them and affect their health and their access to health care. We're looking at whether a health facility's lack of access to digital tools is because they don't have access to consistent and reliable power. And can that be addressed? Offering cold chain medicines like the COVID vaccine, other vaccines, insulin to treat diabetes, cancer medications. Is the lack of access simply the lack of refrigeration? Is it the lack of training? Is the lack of refrigeration tied to lack of consistent power? Is it a facilities issue? All of these things and the data that helps drive the answers are on that frontier. The use of data and analytics is going to be a huge part of healthcare giving in the future. And when we think about giving, when I think about giving, I think both in terms of support, private support from companies, from individuals, from foundations that support the work that organizations like Direct Relief is doing, but also Direct Relief's work is healthcare giving. It's mobilizing those private philanthropic resources. And so what Direct Relief is looking at, I think, is going to be a reflection of what we see and can transmit back to the philanthropic community. I think is going to be a pretty good predictor of where we're headed on that frontier. So I think you're going to see money, medicine, and data as being the three channels of philanthropic giving in healthcare as we move forward.
Yeah, yeah. I'm going to have to echo you on the issue of, the fishing rod analogy. I think for me, and I hope for everyone, healthcare is one area of public service where, you know, bureaucracy is required.
Yeah,
Red tape isn't just, a barrier of entry. It's really required because, I mean, mistakes still happen, even
right,
with licensed drugs that have got clearance. Mistakes still happen.
right.
And, people need licenses and they need tests. They need everything that we could possibly think of before distributing the services and the product to the end consumer. So I'm going to have to agree with you on that. Um, Next question is, what roles do technology and data play in your daily work, and what improvements are you planning on, if any?
Right. Well, to get a clear picture of the role of technology and data, um, let's step back and start again with what direct relief is. I mentioned, the frontier is material, it's funding, it's data. Those are the channels that direct relief is currently directing resources through. Those define the organization's work. So in the mobilization of these three channels, these three programmatic areas, on a humanitarian basis at no charge with the quality, efficiency, and precision of a commercial business on a global scale, technology drives all of those. Technology drives all three aspects of the organization's work. So I was thinking about this. I was talking with Direct Relief's vice president of for research and analytics, and I said to him, so, beyond the obvious things, where do you see us headed? And he said, well, wait a minute, what do you consider the obvious things? And so it's easy to take things for granted when you're in the middle of it. So I want to start with what I think the obvious things are that really drive the organization's work. So the things that we see are things like geographic information systems mapping, that informs decision making, but also adds transparency and accountability to what we do. I mentioned earlier that we operate on an SAP backbone. We use a CRM system like any business would. We have a fairly robust website and news feed, and we integrate with Google News and Apple News, and the technology that drives our ability to do that, our media channels are all, obviously, but fairly simply technology driven. And all of that helps us continue to make gains in the precision and efficiency of what we're doing. So there's that. The payment systems that are integrated into our website and into our donation database and relation systems, that's all fairly critical. And that's the obvious stuff. There's some really powerful things going on behind the scenes that are driving the organization's work that are not as obvious. Direct Relief's Guide Star is always, are we performing our functions in a way that delivers the most value, the most social impact, as efficiently and precisely as possible? So everything that we do, I think, has a commercial analog. And where companies are looking to deliver shareholder value, the good ones are looking to deliver customer value. Our parallel to that is social impact and public benefit. So when we apply technology, we're looking at the internal functions to make donor funds go as far as possible, to make those in-kind donations go as far as possible. We know that those donations are not given to Direct Relief for Direct Relief's sake. They're put in our custody to be good stewards in order to convert them to a public good, to convert money into the medicines, the materials, the medical services that people need, and to make sure we're delivering healthcare material, equipment, and medicine where it's needed most to have the most social impact. And so, when we take that look, now we step back from these obvious systems that drive our logistics and maybe make the basic operations work well. But what can we also do to um, to really drive the impact and improve the
Yeah.
efficiencies. So the use of machine learning and AI to predict health infrastructure at the site level is a potentially powerful, it's an actual and potentially powerful driver using statistical analysis of open data sources, how things are related to take what we know and figure out what we don't know. Um, that is where I think there's tremendous power in technology in our daily work. And I think it's where the future is. It's where the potential for improvements are. Because if you think about things like, let's take a simple example in California, where Direct Relief's headquartered. There's a lot that we'd like to learn about the healthcare safety net. Even though we've been working here for 73 years, cold chain and power backup are critical in this environment where we're so prone and susceptible to natural disasters, wildfires, earthquakes, and we also have a very high percentage of people who are relying on safety net health facilities. So using machine learning and AI in partnership with the companies that are developing these tools and with university researchers, we can be more proactive now. We can get away from relying on surveys and census-based data gathering to be more proactive and predictive, which then is actually a program resource in itself. These tools and these predictive abilities have been critical in Direct Relief's ability to mobilize resources during the COVID-19 pandemic, for expanding cold chain capacity, and for anticipating need in hurricane and wildfire prone areas. The data itself is now a program resource. We can give the data to the California Primary Care Association, the state of California, our partners at Harvard University that we're working on research for figuring out the broader impacts of wildfire and running simulation models on real-time population displacements. So the future is, I think, finding more efficiency, precise delivery, that infrastructure prediction. It's universal, and we can expand that globally. We can't take on the entire world, but we can play a catalytic role in critical locations that we can identify by bringing these pieces of infrastructure and prediction online. We can do demand analysis for healthcare in particular places where we can make a significant public benefit impact, and then in turn take that to the philanthropists, the companies, and the foundations that support our work to direct resources and to be accountable and to drive transparency. So I think doing more predictions and integration on a large scale, getting more accurate, modeling in broad strokes the way Amazon does predictive analytics. Direct Relief is essentially a logistics company. We are a licensed, we're charitable, but we're a licensed wholesaler of medicine and prescription drugs. And just like the Amazon model of trying to anticipate their customers' needs as a way of delivering a high quality service and then delivering it fast and precisely, they're doing predictive analytics constantly. We don't do that yet, but I would love to see the next steps be modeling like Amazon for our supply chain management process for a humanitarian purpose, modeling our partners' shipment flow, modeling emergency response activity in a way that leads to anticipatory design, integrated modeling into humanitarian logistics. Again, it's done in business, so there's no reason why in the future I think it shouldn't be done here. They do it to gain efficiencies and increase profits. We do it to gain efficiencies and increase social benefit.
Yeah, and I must say you're in good hands with SAP because I know they've got really good ERP systems, the enterprise resource planning. So the next question is, what makes your organization different from others, and which impact matrices, or rather metrics, do you rely on?
Well, the growth and the expanded reach that Direct Relief has experienced over the decades, and the factors that are obstacles to growth have never been issues of supply and demand. They've always been constraints around technology And not that the technology isn't there, it's developed, it's being applied beautifully with fantastic results in business. The constraint is integrating it into the humanitarian charitable work. And when we brought SAP into the organization, which by the way was a philanthropic resource on the part of that company that they had never seen as a philanthropic resource before. It was something that the organization, Direct Relief, could never have purchased the licenses for SAP. It was outside of our budget. It would have taken at least one annual budget to be able to procure it.
Congratulations on that, by the way, because
Thank you.
I mean, those guys are the best of the best, really.
Well, and that's Direct Relief's model. It's look for the best tools and technologies and business practices out there in the world that are driven by profit motive and bring them into this humanitarian effort where we are driven by public impact. So that integration alone was a platform for tremendous growth. And so the approach to bringing in these principles, our founding story, Direct Relief was founded by immigrants, businessmen whose perspective was not us helping them, they were them. They fled Europe during the Second World War, and they were simply looking for a way to help folks rebuild their lives afterward, strengthening existing health systems that are serving vulnerable people. That attitude of respect and dignity and earning trust every day and delivering only what's been specifically requested. Those are the drivers that have, I think, distinguished Direct Relief and helped it earn trust and earn respect. Seeing the recipients of the aid that we're delivering not as objects of pity, but as people with dignity who find themselves in a difficult position, caught up in the events of history, the effects of poverty, systemic discrimination, conflict, and could use some help. Not seeing the organization as saviors, but simply providing a support function for existing facilities for people who are already on the ground in the communities where we want to help, supporting their work without judgment. And these kinds of partnerships, that was novel at the time. And it's still,
Trust me, it still is. It still is.
It's not, we'd like to see more of it in the world. Back then, there was no such thing as corporate social responsibility, right? It was just called doing the right thing. And today, I think I'll agree with you, there are still gaps. I would love to see more of that. But there is still a desire, if you can show a trustworthy, reliable channel that's consistent with the business model, it makes it much easier for the CEO of these corporations to go to their boards and make the case for taking their scale, their efficiency, and using it, and their cash, and their products, and using them as philanthropic resources. And those relationships continue to distinguish Direct Relief. The proof of the pudding for a charity, for a humanitarian organization like Direct Relief, is not always in its metrics, because the things that people want to measure are not always the most important things to do. And the things that are easiest to measure are not always the most important things to do. And sometimes the most important things are very difficult to measure, and they don't always have an immediate metric. And so one of the things that I think that we try to do as we measure our own work is to step back and say, well, what are the proxies for the impact that we're looking to make in the world? So if we start with a shared assumption, and I think you and I agree that healthcare is important, even if we're just looking at the narrow perspective of the economies of cities, healthcare is important. So if we start there, and we know that the drivers of quality healthcare include access to resources, money, medicine, medical equipment, data, and analytics, let's start by looking at how much of that we're able to deliver. If you look at our website, on the home page, on the landing page of the website, are the core metrics. How many doses of medicine? How many health facilities are we delivering to? If we assume that these health facilities are the right ones, and that they're serving vulnerable populations that wouldn't otherwise have access to medicine. And you can dig deeper, number of shipments, number of healthcare facilities, number of doses. You can look at the weight of our shipments. You can look at the wholesale dollar value of shipments. You can drill deeper into the website and look at maps that show where the aid is going and a breakdown of the type of aid. Those metrics, I think, are really fundamental. And then we look to, again, for a charity, it's kind of hard. But we're also under a critical microscope. People are very fussy about where they give their money and valuable precious resources. So what are the third-party rating services saying?
Yeah.
What is Fast Company saying? Rated by Fast Company among the 10 most innovative nonprofits repeatedly. Forbes rating Direct Relief as among the top 10 charities. CNBC rating Direct Relief as among the top charities changing the world. Charity Navigator, perfect 100 scores by Charity Navigator year after year, among the 10 best charities. Who else? Who matters in terms of how we're trying to do what we do? Receiving awards by the U.S. Chamber Foundation, Entrepreneurship Awards, ESRI User Conference Awards for our use of story mapping. Again, looking at not just folks who say good work, pat on the back, but what are they looking at and why are they looking at them? Are they looking at innovation and the use of technology? The Peter F. Drucker Award for Nonprofit Innovation, recognizing Direct Relief for its use of information technology to deliver humanitarian aid. I think that's the kind of acknowledgement that reflects what we're trying to do, and not just saying what's how much revenue did you bring in. That's not I think as powerful a metric as looking at ratings that validate the methodology. Those are the kinds of things that we're looking at.
I just remembered what I wanted to say after the previous answer you gave. And that was after we talked about, SAP's capabilities. Last time you showed me your warehouse.
Yeah.
And you also talked about, all the information that people can get almost in real time across the supply chain and the value chain, right? All these different measurements that you offer publicly. And that is, very good practice. Transparency breeds trust. But I also think that seeing is believing. And anyone who wants to give or is considering of, contributing in a very, sort of sizable way, I think they should take a visit to your warehouse. It's enough to convince anyone because you've got the experience and you've got, relative scale. There's always room for improvement, but I think if people can go there and see the facility, it really goes a long way.
Well, thank you for saying that. I'll take this opportunity to extend an open invitation. Folks who are able to come to Santa Barbara to see our facility once we're open again, post-COVID, and we can bring in visitors safely. I would encourage folks who are in the area or want to make a trip out here. I would be delighted to arrange a tour. And if that's not possible, we can arrange a form of a virtual tour for folks who are interested in seeing for themselves.
Lovely. So the next one is, how sustainable is your model and how do you engage with like-minded entities to strengthen your ecosystem?
Well, I think I've touched on this throughout our conversation. I'll just take this opportunity maybe to underscore again. We've been doing this for 73 years. We've grown to delivering more than $1 billion wholesale value in material aid for the past couple of years each. There's still vast unmet need. Wealth disparity is growing. Natural disasters are becoming more frequent and larger in scale. There are approximately 79.5 million people, forcibly displaced persons in the world today, according to the United Nations Refugee Agency. They don't have access to healthcare without some assistance. On the demand side, as I mentioned, there's no issue of sustainability. And on the supply side, our partnerships with individuals, with companies, foundations, has continued to grow. And we've seen that. Now, that will continue, I think, as long as there's need. It'll continue as long as the basic human qualities of compassion and empathy are allowed to flourish. As long as philanthropists and companies with a philanthropic mindset and employees and customers who more and more are insisting that the companies they work for and do business with be more than just generating profits, but be a part of their communities, support the communities where they do business. Baby boomers are leaving a lot of money to their children who are having fewer children of their own and who have a more socially conscious approach to what they do with their money and how they're investing and what they do with their time and where they work. Investing in charity has become a form of investment. So this organization is built on partnership. And by nature, they are like-minded entities. They are looking to make a positive social impact for the public benefit on a charitable basis, public service using private resources. And they are the ecosystem. They are the ecosystem that Direct Relief has built around itself, has networked, and it continues to grow. We started at a grassroots level and we continue to grow our network at a higher level using organizations like associations of community health partners, intergovernmental organizations, international organizations. We are a formal member of the Association of Southeast Asian Nations. We have formal arrangements with Caribbean nations and emergency response collectives internationally. So this is the way the ecosystem grows, connecting through the World Health Organization. The Pan American Health Organization has been an instrumental part of expanding and strengthening the work that Direct Relief is doing to support healthcare in Latin America. So again, it's never been a matter of supply and demand. We're adopting the technology to increase our capacity. As long as there are people who want to help and there's a benefit for a humanitarian supply chain to connect those who want to help with those who need a hand up, I think we'll be able to see what Direct Relief is doing sustained really for the long term. We've seen it in the pandemic. The barriers to entry are high in terms of the regulations that you were describing, and Direct Relief is in a unique position with respect to those barriers. Again, from a commercial standpoint, we look at barriers to entry into an industry and the sustainability of existing firms that have a significant footprint within sectors or within an industry. And over the decades, Direct Relief has created such a strong network, has been able to get past those hurdles. I think those are really strengths. They are opportunities. We are always looking for like-minded partners who can help more efficiently, more strategically, expand that reach and help more people. So, as I said, there are a lot of barriers to entry in this regulated business of international logistics and prescription medicine and finance, and so there does seem to be a long-term role for Direct Relief to play.
And I'm just going to have to elaborate for a minute or two there. I also think that with some of the research that I've done and the conversations that I've had with some interdisciplinary research groups, especially in investment management and international government partners, there's been a surge in public listings on the NASDAQ. And so, record highs in terms of IPOs and specs. And some of those are really driven by policy, not
Yeah,
just the supply demand of people working remotely. The global economy will have to COVID proof itself.
yeah,
Okay. If we really have learned something from this pandemic, then we should not repeat anything of its kind in future.
agreed.
And so that means that, these technologies will have to become the norm.
Mm,
These systems, very sophisticated platforms like yours, will have to become the norm. So in essence, what we're saying here is these high barriers of entry do exist and will continue to persist. And there's a lot of relief and partners needed to get the services out to the people. I mean, if you look at places like Africa and India, where we're expecting population explosions, especially in the youth demographic, around 2030, 2035, we're seeing, population growth curves spiking. And access to healthcare for young people is very important, like we said at the beginning.
mm,
Get them early, fortify the immune system. Otherwise, they're going to be huge burdens. And if they're not healthy, they can't work. They can't even go to school.
agreed.
So challenging times ahead. Hopefully we can continue, with more interventions beyond the podcast. So the next question is, to what extent does data privacy apply to your work, and what measures do you take to protect people's privacy? So for anyone, I guess, who would be wondering, oh, so Direct Relief is using all these big data APIs and data lakes,
Yeah.
and all the machine learning and the data sharing, everything. So I mean, what can you say just to, just calm people down, because there's
Sure.
also this huge concern about data these days.
Yeah, absolutely. And at a personal level, I'm one of those people. I think data privacy is critical. And simply as a matter of respect, respecting privacy is a very high priority. And it is certainly a high priority of Direct Relief's. For your listeners, a good place to start is the website, Direct Relief's website. Check out the privacy policy that reflects the organization's values, and part of that important level of transparency. So first, we'll talk about privacy very briefly on a couple of different levels. One is, we're not working with patient data. So that is not a concern. Donor data we take very seriously. We don't share any information about our donors, the individuals who make cash contributions. That's not shared with any other organization. It's not sold. It's not distributed in any way whatsoever. And we use, again, I will defer to our IT experts, but I know that they are um, working with great vigilance to protect our systems from breaches, and to protect the privacy of our donors. The work in technology, that is certainly, if people weren't worried about that, and in the context of smart cities, I know that that's a major concern. And so I know the work that we're doing with, for example, displacement data is anonymized. It's under agreements that require respect for privacy, protocols that require respect for privacy, engaging with university research teams that also have high-level privacy policies that meet the standards. So I would say, at every level, we're using protocols, policies, anonymized data when it's appropriate to use, databases and data streams that are sourced by others. in order to make sure that we maintain the trust we've earned, um, and to enhance the trust that we've earned. I know that as a business person, trust is a lot easier to lose than it is to earn. And Direct Relief has worked very hard for more than 70 years to earn public trust. And we will continue to work very hard to maintain that trust.
Lovely, lovely. All right. So the last question, which is the granddaddy of them all, or the grandmummy, politically correct these days. What elements of smart cities should governments prioritize on to create happier and more fulfilling cities? This is very subjective, but just share your perspectives on that.
Sure. This really is the essence of why we're here, and why we're having this conversation. I think that to make sure you understand what actually makes people happy, what are their values, what do they need that they don't have, and just because they don't have it doesn't mean that they need to have it to be happy. So what are those things? Make sure you understand the root causes of what drives happiness and fulfillment and satisfaction in the context of a city and the services that a city is intended to provide. What are the expectations of the people who live and work there, of the city? I think to achieve the quality of life that people are seeking, and not just what the bureaucracy wants, or adopting technology because it's new and shiny and exciting. I would say be careful about partnering with companies who have a profit motive and using partnerships with those companies to drive policy. The policy should drive the partnerships and the technologies that are adopted. It's not good policy just because it's smart technology. First, set good policy, and from our perspective here, we're talking about healthcare, health, and the drivers of health, and access to healthcare. Again, business is driving a lot of this, and just because you can make a good business case for it doesn't mean you're making a good policy case for it. And some things that are important are very hard to make a business case for. And so city government and state government, federal government, should be driving and funding the things that really are important for those outcomes. I think that remembering the purpose, improving the quality of life. Best advice I feel like I could give is some of the same advice I've given my kids. Don't do things just because you can. Just because it's cool doesn't mean it's good and useful. Let the outcome, know what your outcomes are. Be very clear about the outcomes you're seeking and how you're going to measure them. And if they are those things that have difficult or ambiguous metrics, take the time to think them through. And just know, are you looking at smart technology in the city because it makes the bureaucracy more efficient for its own sake, or because by making it more efficient, you're offering and providing a public benefit? I would also say, look at the information flow, and figure out what information flows truly are the ones that are what it takes for people to live well in a city. So for example, you can use, and we saw this during the pandemic, you can use wastewater to predict COVID outbreaks.
This is this is a first. I'm just gonna have to say that no one's
And
ever talked about this, so thank you.
And so, is that something that the designers of a smart city would be taking into account, would be looking for? Is it a potential spinoff of some other aspect of wastewater monitoring? So think about what you're doing and why you're doing it. Be sure that there's accountability in your city structures, in your data structures, that are aimed at equitable treatment, not just bureaucratic efficiency. And to make sure that the data you're collecting isn't there just to crack down on people. even if it's well-intentioned, we're looking at potentially being able to monitor and predict human behavior, which is then very tempting to use as a control in a power structure. There are cities that we could look at around the world that are already smart and somewhat problematic in terms of the relationship between how they're using data and the relationship between the power structure and the people who live there. So smart cities, happy smart cities, don't do away with democratic accountability. I would like to see happy smart cities put accountability over data flows to benefit everyone, not to simply become a technocracy, if that's the right word for it, where efficiency is king, people become subject to the technology, and where it's used to create even larger gaps, creating even larger divides that result in a lower quality of life ultimately for everyone. If we're looking at the city as a whole, I'd like to see this. We saw this in mobility data when it first became apparent and available. It can be used for ill, it can be used for good. It can be used in policing and criminal justice surveillance. It could be used in public health. It can be used to monitor the people in power, as well as monitoring the people who have less power. I'd like to see ethics, law, and accountability systems built into and at the beginning of the process. Start with good intentions and make sure that you are building your systems to avoid ending up with Orwellian control systems. And there's different kinds of data to think about. Weather data, aggregated traffic flows, personally identifiable health data. They all carry risks and benefits. They all require, I think, an individualized approach. Finally, I'd say informed consent. People's behavior often reflects a lack of knowledge more than a lack of concern about how their personal data is used. I think we know there's been a lot of research done on decision bias and a lack of understanding, and we've seen how companies have used incentives to encourage people to get their data without fully informing people about the true value of the data in a commercial context. I may not know that my personal information, my privacy, has value to you that it has. And so you may offer me a fairly modest incentive that to me in the moment seems like a worthwhile trade-off. And by the time I realize that what I had was of greater value, it's too late. We have plenty of examples in the commercial world of how this has played out. And I think it's important that we learn the lessons, not to continue to exploit people, but in order to serve them from the perspective of who's the city accountable to. You can get people to give up their privacy by the way you ask them to, or the way you define it, or by incrementally eating away at it. Whether you're asked to buy your privacy back, whether you're asked to pay in order to preserve it, or whether you're being asked to sell it. There's powerful psychology at play, and the consumer often doesn't know that they're being manipulated. Profit-making firms are not rewarded for respecting privacy. They're rewarded for infringing on it. And I don't necessarily mean that in an antagonistic sense. I think that's just the way it plays out. That's how the profit motive incentivizes
Information asymmetry.
Exactly. Markets fail because consumers either make inconsistent decisions or because they're not given enough information to make good decisions. People don't do well with nuance and complexity. They respond very well to simple formulas. And that's important, I think, all to keep in mind. We could be talking about your most important last question here for another hour, but I think I'll leave it at that. I think if cities take some of those factors as priorities as they think about implementing smart technology into the cities, we're going to see happier and more fulfilling quality of life for the people who live there.
You know, I think the 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 biggest challenge also is policy on the AI itself,
Mm,
because if you listen to some of the most sort of prolific researchers in artificial intelligence, there's two major frontiers at play right now. Um, the one that we're kind of bordering on is artificial general intelligence.
mhm,
And general intelligence is basically where AI, reaches the intelligence of the average human being.
mhm.
And then super intelligence is basically where AI is running the show.
Yeah.
But for me, when I read some of the, because I do a bit of coding and I do a bit of ethics and human rights and data and stuff. But I think that in some cases, the AI has fine-tuned itself beyond the knowledge of its custodians. So there's this concept of twin artificial intelligence,
Mhm.
where if enough data sources can share data amongst each other,
Yeah.
um, they can know so much about an individual that they can repeatedly simulate that individual
Yeah.
and then create recommender systems.
I think we're in agreement on that.
100%.